Welcome back. I'm Lauren Day.
And I'm Bridget Namata. Recapping our top story, the number of coronavirus cases rapidly rising in China. It's now approaching 8,000.
The death toll now at 170. Today, Hawaii's health department said there are no cases here and the risk to Hawaii residents remains low.
So the world recently became aware of the coronavirus. There's a lot of information, a lot of misinformation about what exactly it is, which is why we have internal medicine specialist Dr. Rupi here with us now.
Thank you for being here. Again, we do want to clarify that there are no cases here in Hawaii, but of course, many people concerned and on high alert. So even though we're hearing a lot about the coronavirus, it's not a new virus, correct?
So the coronavirus is actually part of a group of viruses called the coronaviruses. There are 7 that can infect humans, and this is one of them that has gone from infecting animals to now infecting humans. That's what the big concern is, because this is brand new in humans. We don't know how it acts, and that's where all the fear is stemming from.
So if a doctor or hospital here in the state sees a case, what are they supposed to do?
They have to notify the local or state health department. They're going to be the ones to help actually take the specimens, get the specimens where they need to go, do the surveillance and the follow-up. So that's very important if there is a suspected case that they are notified.
Let's talk about these masks, because Bridget and I were talking about this, but hard to get your hands on one right now across Oahu, across the state. Tell us about mask effectiveness.
Okay, so there's different masks, and that's why I brought a couple of these today. The ones that you traditionally tend to see are this type right here, these kind of gauzy, flimsy masks that a lot of people are wearing. These are called surgical masks, and the concern with this is that they're not very effective. Now, if somebody has an infection and they wear them, that's great because it creates a barrier. However, if you're trying to prevent yourself from catching, let's say, the coronavirus, it's not that effective, and actually particulate matter can get through it, and it doesn't really stick to the face very well. If you try to put it on, you have some gaps, and it's not really really tight on your face.
It's pretty thin.
Yeah, and so it can block some big particles, like if somebody coughs onto you. It can also help to try to prevent you from touching your face, which is great because we're touching the environment, we're touching our face, and that can actually transmit the infection. However, that can backfire. For people like me who kind of fidget with our masks, you can actually touch your face more, especially if it's uncomfortable.
Okay.
So you do have to be cautious with this. It can be a good barrier. You can use it for a little bit of peace of mind, but just be aware that it does not prevent the transmission, and it is not that effective. On the other hand, we've got an N95 mask here, and this is what healthcare workers are using to prevent the transmission. Now, an N95 mask actually is about 95% effective at preventing particles from getting in. That's great, and we use it as physicians when we have a suspected case of a respiratory illness that we're concerned about, but they can be uncomfortable. And for wearing them for long periods of time, people can have a hard time breathing, so they're not that practical. So at this time, there are no recommendations that have been given in the United States to be wearing these masks. These types of masks, more peace of mind. This one, at this point, only for healthcare workers, but that's a little bit about the efficacy.
Would you say
of masks.
this is necessary then?
At this point, it's more, again, for peace of mind, because it is really that effectiveness. If we keep that in mind, it's not going to prevent a virus from coming or from getting through, but if it prevents you from touching your face, that's great. That's actually a good thing.
So I know that these masks are kind of flying off the shelves, but Dr. Rupi, are those available for people to?
They are available for purchase.
Okay.
So you can find the N95 masks.
N95.
They're actually called respirators.
Oh,
okay.
Respirators.
So if people do want to wear a mask, it's just to be extra cautious, that would be the best way to go.
So again, these can be fairly uncomfortable. If you are worried, and just for peace of mind, you want to wear one of these, what I would suggest is wearing it properly. So first and foremost, always wash your hands. The worry is that you're going to potentially spread germs and whatnot onto your face if you're not washing your hands before you use a mask, and also after you take off the mask.
Got it.
So by putting this on properly, if you guys want to go ahead and grab one, you want to have the white part actually onto your face and the colored portion outside.
Okay.
So there's 3 layers to a mask, and the inside is actually the one that collects moisture. The outside repels moisture, and the inside, that 3rd layer, is the filter. So if you wear it the wrong way, it's still fine, but in general, if you can wear it the correct way, the white side is on the inside. There is a flexible portion at the top, that little bendy piece. What you do is you put the ear loops around your ears, And
So bendy wire goes
bendy
by your
wire
nose.
goes by your nose, and then you're going to pinch so that it fits firmly onto your face.
Well, clearly we have a lot of questions, Dr.
Yeah.
Rupi. So since we have a lot of questions, I'm sure a lot of people, viewers do. So we did ask some folks to ask us some questions on the KH12 Facebook page. Let's get to it. All right, Will, he asks, what are the chances of a person contacting the coronavirus here in Hawaii?
At this point, contracting in Hawaii, the risk is very low. Right now, we only have 5 known cases in the entire United States. There have been no known cases in the state of Hawaii. Also, there has been no known human-to-human transmission that's taken place in the U.S. as of yet. So that's a sign that the risk is fairly low. If you take that into comparison to the influenza virus for this season, we've already had 15 million cases compared to the 5 that we have here. So you have a much higher risk of getting influenza than you do the coronavirus.
That really
All right.
puts it into perspective.
Absolutely. All right, let's ask another question, shall we? Okay, Tommy asks, how afraid should we really be? And is the flu vaccine of any help with this virus?
So it's important that we don't panic at this point. We don't know a lot about the virus. We need to stay on top of it, and we need to take precautions. But it's important that we don't panic. As I said, there's only 5 cases in the U.S. at this point. We really need to be vigilant and watching what's unfolding. And in the coming days, we should have a much better idea of what's happening. The flu vaccine does not help with the coronavirus. However, because, as I said, 15 million cases of flu this year, 8,000 deaths already in the United States, the flu vaccine would help with that, and we are at much higher risk for the flu.
Okay, Dr. Rupi, I think we have time for one last question. Let's see. Jordan is asking, is there any threat from mail and shipments from China? Very interesting.
That's a great question, actually. So the concern is that the virus could potentially live on a surface, right? In general, viruses like to live in living beings. So if it's on an inanimate surface, the likelihood of it surviving the time frame that it takes to get here from China, usually 2 to 3 days, is highly unlikely.
So basically, someone who could be infected with the coronavirus in China touches something, it ends up coming here.
That was a
Not
good question,
necessarily
though.
like you. Yeah, thank you, Jordan.
Yeah. And Dr. Rupi, thank you so much for being here and
My
joining
pleasure.
us. I learned a lot, huh?
Yep.
Who would have thought?
We're
But
probably going to see
good
a lot
tips.
more of you because we still don't know a whole lot about this coronavirus. So,
We'll find
All right,
out
Dr.
more.
Rupi, thank you so much. And make sure to go to our Facebook page right after this newscast. Dr. Rupi and I will be doing a Facebook Live. We will be answering more of all of your burning questions.
I know I have some. Let's send things over to Jeff.